Good evening, everybody, and a very happy Mother's Day to all you lovely ladies out there. I'm Dr. Damodar Rao. I'm a consultant in fertility laparoscopy OBGYN at Rao Hospital, Coimbatore. And today I'll be doing a live question and answer session and be taking all your queries regarding infertility, obstetrics, gynecology, and laparoscopy. Any doubts, please feel free to send it, and I'm here to answer all your questions. So meanwhile, before I start getting in my questions, I just wanted to say a little something about coronavirus and the stigma that's being attached to the disease nowadays. A lot of people are coming out of corona after being infected with the coronavirus, and a lot of stigmas attached to that. People are trying to avoid them, stay away from them. Uh, Please don't do anything like that. We all know about all the things that we have to do to protect ourselves. These people have been through difficulties and they've come out. And if you look at India as a nation, we've really done well. I think it's because of the lockdown and also our inherent immunity that we have against many diseases. So we will come out of all this. We will do well, and we will beat Corona soon. Okay. Um, and there was also a lot of people asking me what is the effect of coronavirus on pregnancy as such. So if you look at the effect of corona on pregnancy, not many studies have been done. There are quite a handful of pregnancies, and if you look at it, there is no transmission of the virus. If the mother who's carrying the baby is infected, there is no proof that as yet that the virus can be transmitted from the mother to the baby through the placenta. Only time that the virus can be transmitted is from during delivery, the fluids. If it That's the only time when the baby can be infected. That is from the skin of the mother to the skin of the baby or through the eyes or nose of the baby. Okay, so corona is still not known to affect the baby intrauterine as such. All right, we have a question which says, can I try for pregnancy? It's from Reshma, and can I try for pregnancy now? Is it safe? Yes, that's a very good question, Reshma. Initially, what they were saying is that don't try for pregnancy because we didn't know the effects of pregnancy till now. But there have been enough studies, a handful of studies at least would say that it is all right to start, trying for pregnancy, and you can at least start planning for pregnancy, especially if you're on the older side and if your ovarian reserve is less, or if you want to go for an IVF or something like that. Don't delay any of that. Talk because of the coronavirus. Talk to your doctor. We will see how we can help you and guide you, and accordingly we can plan for pregnancy. Or even if you want to try naturally, there is no restrictions as such. You can please try for a pregnancy. Praveen, is there any vaccine or medicine for coronavirus? Well, medicines as such, I think we've a lot of beating around the bush has been happening. They've been talking about hydroxychloroquine. They've been talking about antiretroviral. They've been talking about retroviral drugs, antiviral drugs. They've been talking about anti-cancer drugs. So all this has been tried. Of these, probably HCQ, hydroxychloroquine, has had some sort of success, but not with complete proof. So I do not, advocate taking hydroxychloroquine as such. Coming to vaccines, if you look at it, I think vaccines, Italy, there's a group from Oxford, and there's a group in Israel. They're all coming up with vaccines, and they're still in research. I think it'll take another 3-4 months for the vaccine to come up. So I think before the vaccine comes up, I hope we develop herd immunity, which usually also takes about minimum 6 months to develop. So we're in a tough spot when it comes to that. But thanks to the Indian population and our inherent immunity, I think we're doing well so far. We have Leah. One doctor told me that I have PCO because and my weight is 106 kgs and we have to undergo bariatric surgery. Is there any other alternative? Leah, hi, thank you for that question. Well, because of PCO, yes, you can put on weight. Okay. But before your question was about bariatric surgery and PCO. I agree it's very difficult to lose weight when you have PCO, but do try methods that are available. Me as a consultant, I always ask my patients to first try weight loss through diet and through exercise. Try this for a year, especially if you're on the younger side. Don't hesitate to even try for a whole year. And even after that, if if you're not able to lose weight, definitely you can do bariatric surgery. It's become a very standardized procedure now, and I have advised bariatric surgery for a couple of my patients, and they've done well. They've conceived after surgery. Also, you should remember that bariatric surgery is not a permanent solution. Even after bariatric surgery, you will have to look into your diet and things like that. So bariatric surgery is definitely an option if you're not able to lose weight easily. Harshita. Hi, doctor. I've been told my placenta is low lying on scan and just completed 12 weeks. Is there anything to be worried about? Harshita, hi. You are now 12 weeks. All right. So basically, if your the placenta is always low down in the beginning of pregnancy. That is, in the first few months of pregnancy, the second, third, fourth month, it's usually low lying, and that's physiological, that's natural. Okay, and as pregnancy advances, the placenta will come up. Okay, it is called, it migrates up. So usually on scans, when you see it in the 12th week, third month, fourth month, if your placenta is low lying, don't worry. The placenta will definitely migrate up. All you have to do is have consecutive scans. Do a scan. On the fifth month, they will definitely ask you to do a scan and see how the placenta is then. Most probably by the fifth month, your placenta would have migrated up and you wouldn't really have to worry a lot about your placenta. But if it still continues to be low lying, then definitely they will advise you accordingly. You'll have to take bed rest, and serial scans will be have to be done to monitor how your placenta is doing as your pregnancy advances. There's another question which says, "Hi doctor, what precautions should a 3-month pregnant lady be taking against the COVID-19?" Okay. Against COVID-19, well, whether you're pregnant or not, the precautions are going to be the same. All right. You have to follow all the principles of wash your hands frequently, use a mask while you're going outside, or even if you're inside the house, you can wear a mask. People have been talking about that too, about wearing a mask, even if you're inside the house, it helps. If you're pregnant, yes, more so. Please be very careful about who comes into your house and where you go. All right, it's better you stay home, don't travel too much. And another thing that I tell my patients is always do some steam inhalation, do it twice a day, and also gargle at least twice or thrice a day. These both have natural protection for you against coronavirus. Otherwise, coronavirus as such on pregnancy, you don't have to be really worried about it. It might even just come as, even if you get it, don't have to be worried too much. There is no known effect of coronavirus on the pregnancy or on the baby. Yes, very rarely they talk about preterm labor and things like that. But most of the time, you will just get it like a common cold and it might go away. All you have to do is take care of yourself. We as Indians, I think we have good immunity and you'll be fine. Ishwar Subramaniam, is the hospital open for consultation now? Can I come for an appointment? Thank you, Ishwar. Yes, we haven't shut shop at all. We've been open even during the lockdown. We've been asked by the government to stay open, and we've been open to look after all our pregnant women, especially. Initially, we weren't doing any, infertility or gynec or any elective surgeries. We were only looking into normal deliveries and cesarean sections. But we're right now we're open for everything. We're looking after all problems. We're a mother and child hospital. You're free to bring in anybody, be it your child or your mother or your sister or yourself, and get yourself checked. Um, we have been always open, yes. The next question is, my daughter is 15 years old, has very painful cramps during period every month and does not go to school due to pain. Please advise. Yeah, so painful periods, yes. A woman initially in her younger, when she's younger, she definitely has painful periods, and this can be normal to most women. But you're talking about so painful that she doesn't go to school on a few days or during that time of the month. This is not normal. Okay, most of the time the pain can be bad, but it's tolerable. If she is not going to school because of this, please go to a gynecologist. Please get a scan done. It could be various reasons, like she could be having a fibroid. She could be having something like endometriosis. Endometriosis is something that can cause very painful periods. Do not neglect it. You can give medicines. There are medicines available which can be given to your daughter, and she will have pain-free periods, and she won't dread it every month, and she'll be able to go to school, and she will have a very, very normal life. So please go to your gynecologist who was close by. Don't travel too far. Go to your gynecologist and get a scan done, and just to rule out if there are no fibroids or endometriosis. If the scan is normal, then don't worry. You just have to reassure her. You can just give her a few painkillers during that time, and you can tide over the crisis. Um, Ilaya Bharani, doc, I'm 43 years old and I've been diagnosed with a 12 centimeters fibroid and I have heavy, painful menses. I was advised open surgery by a doctor in Bangalore. I want to know if laparoscopy is possible. Ilaya, yes, thank you for this question. 12 centimeters fibroid can be challenging, and yes, I'm sure you're going through a lot of pain and heavy menstrual bleeding. And I'm sure you've been given medical treatment already, which has failed, and you've been advised surgery. Laparoscopy can definitely be done for this. At Rao Hospital, I'm the laparoscopic surgeon, and we uh, deal with a lot of large large fibroids, for whom we do a hysterectomy or only remove the fibroid. So based on what you want and what is required, we can do it laparoscopically. Laparoscopy definitely has its own benefits. It's a keyhole surgery. The scar is small. Your recovery is quick. You're not going to be lying in bed for a whole month. You can go back to work quickly. Postoperative complications are less. Laparoscopy is definitely the way forward. And yes, for this size of fibroid, Rao Hospital is an expert and pioneer in doing huge fibroids. Nazvina Beg, is it okay if I get spotting 2 to 3 days before my period begins? Lately, I am finding spotting whenever I work out. Is it okay? Spotting sometimes before your periods can happen, but if it's happening all the time, then it's not normal. You will have to go and get a scan done. Sometimes you might come across something like what is basically called a polyp. Okay, if you have something called a polyp, then definitely we will have a follow-up of the polyp. Is it growing in size? We'll just wait and see. Sometimes the polyp might fall off on its own. If it doesn't fall off on its own, even 2 to 3 cycles, then definitely we will have to remove it. The procedure to remove it is very, very small. It's called hysteroscopy, and it's just a daycare procedure, and we can do it. So definitely do go and get it checked, get a scan done at least. Um, What precaution is your hospital taking if I come for an appointment? Okay, this is probably against Corona. Yeah, we've been doing a lot right from the beginning because we've been open even during the times of lockdown. So uh, right from the entrance, we've been, you know, not even right from the entrance, actually from the telephone call, we uh, ask the patient a couple of questions like your travel history, occupation, uh, have you, whom have you been in touch with recently, where are you coming from, where have you traveled, etc. All this is asked, and do you have fever? So there are a bunch of questions we ask the patient, and based on this, we decided the patient where the patient should go in the hospital. This is called triaging. And basically, when the patient comes to the hospital, we have the infrared thermometers and non-touch thermometers. And there's again a screening that is done even before you enter the hospital. We have a wash basin now installed right outside the hospital. Everybody has to wash their hands uh, and only then enter the hospital. Definitely everybody has to wear a mask, and we're asking only one attender to accompany the patient. So this will reduce crowding up of the hospital. And we also taken care that not too many patients are there in each part of the hospital, whether it's your scan or your OPD or your lab. We don't crowd patients at all. And all these people are wearing protective gear. The doctors are wearing protective gear, the scan doctors are wearing protective gear, the nurses, they're also wearing protective gear, face shields, masks, gloves. We're doing all of that. And something about our hospital is, I mean, it was designed. We've been around for the last 60 years, so it's an old hospital. The building is also, constructed in a very old fashion. So basically, we don't have rooms on both sides. Even the rooms are not crowded. We have rooms only on one side of the passage, and there's natural sunlight coming in. There's a lot of cross ventilation. Both sunlight and cross ventilation are known to prevent, any sort of virus from spreading or staying inside the room. So all this really, really helps. Even if you look at, we've been trying to advise people to only do cashless transactions, which really helps. And we also have the COVID test available in our hospital, which is only for our patients, and we decide who are the patients uh, who have to do it and who don't have to do it. Before every admission for any patient, we definitely do a COVID test and only then admit them. So we're taking every possible measure that can be done, to prevent COVID from spreading or even entering the hospital. Hi, doctor. I have endometrial cyst. Is that possible to get pregnant without IVF? Brinda, hi. Yeah, endometrial cyst. I did talk about endometriosis some time back. Endometrial cyst is also a complication of endometriosis. It's basically when you have this blood collection in the ovary. So a lot of things, it depends on your age, your ovarian reserve, the size of the cyst, and also your husband's side. Okay, we look into all of this, and then we decide whether you should try naturally, or whether you should have an IUI, or whether you should have an IVF. So please do come over. We can counsel you as to what is possible. Yes, we have had a number of patients who've had an ovarian cyst and conceived spontaneously too. So don't be afraid that you have an endometrial cyst, but we have to deal with it in whatever possible way. If surgery is required, then we do a surgery, or if it is some other assisted reproductive method, we will either do an IUI or IVF if required. So definitely, yes, even if you have an endometrial cyst, you can definitely get pregnant. Can I exercise during pregnancy? This is a question by Sharmila. Yes, absolutely. You can exercise during pregnancy. You should exercise during pregnancy. There is nothing like, pregnancy exercise is bad for pregnancy. Only thing you should keep in mind is what we do is usually we do a scan during scan that we do at the 12th week and the 16th week. We look at the length of your cervix. That is the mouth of your uterus. That is what holds the baby, inside the uterus. So this is these scans are very important. Based on these scans, we can give you a rough idea as to whether you should take some rest during pregnancy or if you can be active during pregnancy. So if there are no other indications like a short cervix or anything like that, yes, exercise is advised in pregnancy please exercise, but don't overdo it. There's also a rough guide of where they say just see that your pulse rate doesn't go above 150 or 160. That is also a rough guide for you. And based on that, you can do, plan your exercises as what kind of exercise you want to do and what kind of exercises you're already doing. So yes, exercise is good. It will even help you in having a normal delivery. Whether IVF treatment is being processed presently at Rao Hospital in COVID times. Uh, Thank you for this question. Like I said, initially we were told not to do any IVF procedures at all by the national body, by international bodies. But now they have come out with protocols and they have said, yes, you can slowly open up your IVF clinic. You can start doing the procedures not straight away. For this, giving this 1 month that is coming up now, patients are most welcome to come. We're going to be doing preliminary investigations. It's not like you just come into the hospital and we do IVF immediately. We have to do a bunch of tests, blood tests, ECG, echo, and things, echo for your heart, to see that your body is fit to undergo IVF. We'll have to look at your husband's side, and if you guys have to lose weight, then you'll have to take some more time off. We might add medicines. If your ovarian reserve is less, then we might add medicines, or you might have to undergo a hysteroscopy or something like that. So we will be doing a preliminary checkup this month and studying you and your husband in detail. And then in the coming months, we will be starting IVF soon. Vanita, how to increase my fertility naturally? Okay, this is a common question that is asked. There is no magic pill or magic medicine or magic fruit that's going to increase your fertility naturally as such. All I could say is, live a healthy lifestyle, eat healthy, exercise right, and that is the best way you can increase your fertility naturally. But yes, come to the hospital, get a scan done, get a couple of tests done. Look at your ovarian reserve. That is something that's very important. If it is on the lower side, probably we'll give you some medicines, which can try and improve the quality of the eggs. We can't do anything about the number of eggs as such. And we could also give you certain tips on how to eat healthy and what exercise to do. Leah says, my mother is 54 years old. She is scared to do a mammogram. And is there an other alternative? Well, Leah, 54 years old, and definitely if she has not done a mammogram till now in her life, she has to do one. Mammogram is not that painful as people think it is. Well, it depends a lot on the machine that is used. The person, the technician who's doing the mammogram is also very important. At Rao Hospital, we have a technician who's been with us for the last 15 years. So she's very, very gentle, and mammogram is the best technology that you have to screen for breast cancer. And another second option would be a scan. An ultrasound scan can also be done, but there's nothing like doing a mammogram. And you should definitely, counsel her to come and get a mammogram done. Is it necessary to see a doctor once a pregnancy home test is confirmed, or is it okay to wait out for 3 months or so due to current COVID situation? Well, as soon as you become pregnant, yes, you can wait. There is no hurry to immediately run to get a scan done. But if you have somebody close by, a doctor close by, I would say at least get a scan done during the 7th or 8th week, especially if you're in the 7th or 8th week now. Things are not too bad, and especially if you're in Coimbatore, we're almost going to be entering a green zone. So an early scan is advisable because one thing is we will be able to locate the pregnancy, right? What is important is we want to know as doctors, as gynecologists, whether your pregnancy is in the uterus or a tube. So yes, one scan, if you can do sometime during the 7th, 8th, or 9th week, would be useful. We'll be able to even confirm the heartbeat of the baby by the 7th week. So if you can do a scan between the 7th, 8th, or 9th, um, yes, it would be nice to get a scan done, but if you're really, really scared and you don't want to go out of your in a red zone and you don't want to step out, then you can wait, but it's not the best thing to do. Okay. So ideally, it would be nice to have a scan done, an early scan. That's what we call it, early pregnancy scan in the seventh, eighth, or ninth week would be nice. Um, can I start my IVF treatment at Rao Hospital after the lockdown? Yeah, I think this question was taken some time back. We are taking now patients for infertility treatment. So you're most welcome to come to our hospital this month itself. Please do come. We'll be doing the preliminary blood workup, scan workup, ECG, X-ray. Everything will be taken now. And anyway, even if you come for the preliminary workup now, you won't be jumping into IVF straight away, not this month, but by next month, we'll definitely be after the preliminary workup and everything is done. If after you've had your hysteroscopy, we'll be doing the IVF for you next month. So yes, you're most welcome to come to our hospital now if you're seeking IVF treatment. Reports say that pregnant women are prone to COVID-19. How do they stay safe? Yeah, I've taken this question before. Thank you, Vidishri. What is basic? More prone, there's no exact proof for that right now. All right. They're saying that COVID can affect pregnant women as much as any other normal person. And even if it affects the woman in pregnancy, she doesn't have to be really worried about it, because it can even just come as a, common flu and go away. There is no proper studies to say that COVID is definitely going to affect your pregnancy as such. There have been studies about some of them having preterm labor, but again, no proven studies. So, what should your question was? How do they stay safe like anybody else? Right now, especially when the lockdown has been, taken away and people are going to be traveling more. I definitely request you not to travel outside the house and stay at home as much as possible. Wear a mask, wash your hands, don't touch your mouth, nose very often. Don't let people come and visit you too often. And even the seventh month ceremony that many people have, seventh or eighth month that we like to celebrate, your Valagapu, please have it, probably do it through Zoom or something like that. Don't have a lot of people coming home, okay? And stay at home as much as possible and stay safe. So I think we're going to wind up for today's session. Any other extra questions, we'll get back to you personally. Thank you for all this, for these lovely questions. I hope all your questions have been sorted out. And happy Mother's Day again to all of you. And stay home as much as possible and stay safe. Thank you.